Is spine surgery always the answer for chronic back pain? If you've been living with back pain for months or years and nothing seems to work, it's easy to wonder, do I need surgery? But here's the thing, surgery is not always the next step. In this video, we'll break down when it is, when it isn't, and what your other options might look like. Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon. I've helped thousands of patients manage chronic back pain, and surgery is only the next best step for a small percentage of them. In all the patients that I see in a week, I am maybe operating on only 10% of them. So let's take a closer look at how you can make the right decision for you. Back pain is really complicated. It can come from any number of the structures in the spine, including the discs, the joints, the nerves, even the muscles being on tension. And what works for one person might not work for another. And that's what's so important to understand are the causes of your pain, not just the symptoms. Surgery might sound like a quick fix, but let me tell you, as a spine surgeon, it's not. And jumping in too fast can backfire without fully understanding what you're getting yourself into. So a lot of back issues get better with time. Many respond to physical therapy or medications or injections. And surgery, keep in mind, doesn't reverse any injury or damage, especially if the wrong problem is being treated. The goal is to solve the right issue the right way. So when might surgery be the right move? Well, surgery can be life-changing when it's appropriate. You may be a candidate if you have severe nerve compression causing weakness or numbness, loss of bowel or bladder control, structural issues like spinal instability, or as I mentioned, that nerve compression that causes spinal stenosis that hasn't responded to other treatments. In these cases, surgery can potentially be helpful. So let's review some of the non-surgical options that you might consider. Before undergoing the knife, you can consider things like physical therapy, which strengthens and stabilizes, different kinds of injections, and some of these injections can include epidurals or nerve blocks. They can also include other types of injections like facet injections or SI joint injections, potentially chiropractic care or acupuncture for alignment and tension. These are questions that a lot of my patients ask me, or simply building better movements and habits and stress management. Sometimes small changes can create big results. So how to know what's actually causing your pain? And I'm going to tell you, as a spine specialist and as a spine surgeon, this is actually sometimes can be a really hard question to answer. In some patients, it's really obvious. And then in other patients, it's less obvious. So getting the right diagnosis is critical if one is going to consider surgery. Images like MRIs and CT scans combined with a full physical exam can help pinpoint where your pain is coming from, whether that be the nerves, whether that be the bones or the muscles, or even all three. But without having a diagnosis, you're sort of flying blind. And even the best surgery isn't going to help the problem unless you have that diagnosis. What are some red flags that should not be ignored? Progressive weakness, numbness down the legs, and bowel and bladder issues. These are signs that there might be something more serious, and delaying surgery in these instances can actually have long-term downstream consequences. So these are signs not to ignore. So what does a spine specialist really look for before recommending surgery? So there's actually a number of things, and this is what I always tell patients when they're talking to me about considering surgery. We must get the diagnosis right, as I mentioned. Importantly, as a surgeon, we change anatomy. I can only fix things that I can see on a picture. And so therefore, it's really important that I see that problem on the picture, and equally as important, I don't treat pictures, I treat people, meaning that the picture needs to match the symptoms that I see in the patient. And so that needs to be the first step before even talking about surgery. If surgery might be an option for those patients, then we will ask ourselves, have we tried everything else? In other words, have we exhausted physical therapy, medications, and different kinds of injections? And then finally, do we know that surgery can improve function and quality of life? This might seem crazy, but there actually might be a problem or a pain generator that we know that if we do an operation, the patient might or might not get better. And so we want to make sure that if we're doing surgery, we're doing it on a problem that we know gets better with surgery. If the answer is yes to all three of these things, not just one, but all three, then we move forward. Otherwise, we try other options. And the reason for this is because spine surgery is real surgery, and there are consequences whenever we do anything to the spine. And I always say there's no such thing as a small spine surgery. So here's the bottom line. Surgery is not the only answer, and it's sometimes not an option at all. And many people do get better without it. But it can be used appropriately when it's the right tool, and in those cases, it can be life-changing. The key is a smart step-by-step plan that's tailored specifically to your symptoms as well as your imaging. So if you're on the fence about back surgery, leave a comment. I'd love to hear your story. And if you want more guidance about your spine, hit like and subscribe so you'll never feel stuck in the dark.